Hello, my name is Scarlett Lorenzo. Exercise chapters 5 to 30. 5.1 Write sentences to describe the work of the specialist in each branch of medicine. Number 1 Dermatology. A dermatologist specializes in diseases of the skin. 2 Rheumatology. A rheumatologist specializes in diseases of the joints. 3 Traumatologist specializes in injuries and fractures. For pediatrics, a pediatrician specializes in diseases of children, and obstetrics specializes in pregnancy and childbirth. 5.2 Complete the table with words from A, B, and C opposite and relay forms. Put a stress mark in front of the stress I love in each word. Specialist, specialist, especialización. Practice, practitioners, practice. Consult, consultant, consultation. Assist, assistant, assistance. Graduate, graduate, graduation. Qualify, qualification. 5.3 Fin prepositions in C opposite then can be used to make word combinations with the words in the box. Then use the correct forms of the words to complete the sentence. Good interest specialist work. A pathologist specializes in diagnosing disease from examining cells and tissue. A pediatrician must enjoy working with children. An oncologist is interested in the diagnosis and treatment of cancer. A pediatrician must be good at counseling. A neurosurgeon must be good with organs. Make 5.4 Make word combinations using a word from each box. Two words can be used to it. Consulting rooms. General practitioners. Group practice. Health center. Internal medicine and surgical specialties. 6.1 Make word combinations using a word from each box. Associate, specialist, house officer, on call, provisional diagnosis, radio power, and word round. Match the descriptions with the job titles. Look at B and A and B opposite to help you. Number 1, Dr. Graham has been a pediatrician for 8 years and is responsible for treating the children. I'm here to warm 60. Um, Consultant. Number 2, Dr. Stewart has just started the second year of her foundation program. CHO. Number 3, Dr. Singh has started is training as a surgeon, specialist registered. 4, Dr. Phillips has just graduated and is working in a large hospital in Birmingham. A house officer. And 5, Dr. Miller is in charge of the medical staff in the Birmingham Hospital and medical director. 6.3 are the following statements: true or false. Number 1, a medical graduate becomes registered 2 years after graduation. False. 2, the system of training doctors in breathing is called the Foundation Program. True. The name Senior Health Officer is no longer used in Britain. True. The consultant is usually the first doctor to see new patients. False. Then working is gift. All doctors take turns to be on call. False. And 6.4 complete the text of describing her job. When I get to the work, the first thing I do is talk to the house officer who was on during the last shift to find out if there have been any news admissions. Then I generally see the chart nurse. He tells me if there is anything that needs to be done urgently, such as intravenous lines to put or take down later in the morning. Clerk any news patients, which basically Sol is taking a history. On Tuesday and Friday morning, the consultant does her work round, and I have to make sure I'm completely up to date on her patients. After that, there are usually lots of things to do, like reading a request form for blood test and so on. In the afternoon, I have to prepare for any patients who are to be discharged the next the next day. They're usually happy to be go home, and of course there are the lectures and tutorials in the foundation program on Monday and Wednesday. 7. 7.1 complete the sentences. 1. Someone who specializes in delivering babies is a midwife. 2. Someone who is qualified to assist nurses is a clinical support worker. 3. Someone who is not qualified but is to assist nurses is a nursing auxiliary. 4. A nurse who has qualified is a staff. 5. A nurse who specialist is health promotion, a health visitor. 6. A nurse who looks after a ward is chart. 7. A nurse who works in the community is a district. And 8. Someone who answers the work telephone is a work clerk. 7.2 Make word combinations using a word or phrase from each box. Carry out a procedure, change a dressing, check the temperature, give an injection, and remove sutures. 7.3 Complete the sentence with the correct grammatical form of perform. 1. An isotope brain scan is painless and easy to perform. 2. Biopsy of the pancreas was performed last March. 3. If the patient's condition deteriorates, a laparotomy should be performed. 4. If a diagnosis of meningitis is suspected, a lumbar puncture must be performed. And 5. Last year we performed a randomized doubling group study. And 7.4 Complete the sentence with the correct grammatical form of carry out. 1. I not intend to carry out a large study. 2. Unfortunately, properly controlled trials have been carried out so far. 3. A number of studies have been carried out recently to look at these questions. For a right hemicolectomy was carried out and the patient made a full recovery. And 5. This procedure can be carried out in the emergency department. 8. 8.1 Make word combinations using a word from each box. Ambulance technician, artificial limb, cloud foot, contact lens, health professional, intraocular pressure, occupational therapist, and social worker. 8.2 Which allied health professionals could best help the following people? 1. A young unmarried woman who has just had a baby, social worker. worker. 2. A woman who is having difficult using her right arm following a fracture, occupational therapist. 3. Someone who needs glasses, optician. 4. An elderly woman who has a below knee operation, prosthetist. 5. A man whose wife has Alzheimer's disease, social worker. And 6, a man with a fungal infection of Escherichia coli. And 8.3, complete the test. A prosthetist works with patients of all eyes as a member of a clinical team, but at a large hospital, the patient may need a prosthetist as the result of an accident or amputation following a disease such as diabetes. Alternatively, they may have been born without limb. Orthotists work alongside doctors, nurses, physiotherapists, and occupational therapists to give the people under their care the best possible rehabilitation. They may aim is to enable the patient to lead a normal life at work and leisure. And orthotists often work in a clinical as part of an outpatient service and also visit other centers to provide a service for people with special needs. They deal with people of all ages. For instance, children who have cerebral palsy may require splints to help the walk, and many older people need special shoes to correct deformity if damage any part on the human skeleton may require some form of orthosis. The orthosis may be needed to reposition the body or to relieve pain. 9.1 Complete the table with words from A, B, and C opposite. Admissions, assessment, discharge, operate, operation, referral, treatment. Make 9.2 Make word combinations using a word from each box. Accordingly ill, assessment unit, onboarding, referral letter, and waiting list. 9.3 Which hospital department will be most appropriate for the following patients? Number 1, a woman in diabetic coma intensive care unit. 2, a patient who has just had a radical prostatectomy surgical ward. work. 3. A patient who is to have a skin lesion removed. They surgery on it. 4. A man with a foreign body is in eye accident and sort in emergency. 5. A woman with a threatened absorptions, maternity emergency, uh, or gynecologist. 9.4. Complete the extract from an information leaflet for patients. Information for all patients. When you arrive at the hospital, please tell the receptionist who will welcome you, check your details, and direct you to the waiting area. The length of your visit will depend on the assessment you're going to have. You may need to have some tests, such as a X-ray, which could mean going to another department, or you may be referred to other professionals, such as a physiotherapist or dietitian. You may need to revise the clinical if the staff at the clinic want to see you again. Another appointment will be arranged for you. If you need to be admitted to hospital for more treatment, either as an impingement of your day surgery, you will be told when is this likely to happen. If 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 you don't know the further treatment, you will be discharged to your GPS card. 10. 10.1. Complete the sentence. Number 1. Children over 60 and people with some chronic diseases do not have to pay prescription charges in the UK. 2. Patients with mobility problems may be unable to go out. They are housebound. 3. The average GP consultation is 10 minutes long. 4. A locum is someone who takes the place of a staff member who is on leave. And 5. Care outside working hours is known as out of hours treatments. 10.2. Make word combinations using a word of phrase from each box. Take messages. Make appointments, home visits, perform minor surgery, refer patients from a clinic, supervise staff, and train dressings. 10.3. Which member of a practice team would be responsible for each of the following? 1. Running a clinic for pregnant women, midwife. Teaching a patient how to strengthen his broad leg, physiotherapist. Letting the GP know that a patient can come to her appointment, receptionist. Running a clinic for people who want to lose weight, practice nurse. Visiting a patient who has just returned home after hernia operations, district nurse. Carry out checkups on children in a poor neighborhood health visitor. And 7. Organizing cover for an absent doctor practice manager. And 10.4. Complete the diary for Dr. Stewart's afternoon. Practice team creation over sandwich each lunch, afternoon surgery, 12 10 minutes appointments, coffee break, cook with reception for messages, deal with home visits, and repeat prescriptions, paperwork, referral to secondary care, and phone switching to out of hour service. 11.1 match these activities to the stage of medical education in the UK given in a upside. Dissection cadavers undergraduate, keeping along of surgical procedures, observe and perform postgraduate, working for 4 months in accident in emergence to experience this specialty foundation program, working for taking a 4 week attachment in obstetrics and gynecologists undergraduate, and taking an only course of recent developments in cardiovascular disease professional development. 11.2 complete the sentence. Just before their final year, students have to chance to take an elective in an hospital of their choice anywhere in the world. Problem-based learning contracts with an approach where each subject in trial separately. These days, lectures are often interactive with regular opportunities for the students to ask questions. In clinical attachment, students learn how to treat and manage patients. Student select models can be a topic from outside medicine, such as a foreign language. 6. Dissection of cadavers is an important part of the anatomy component. The medical school at the University of Edinburgh is one of the oldest in the UK. Chief consultant at the Royal or one of the leading pediatrics specialists in the country. The Royal College of Surgeons in Edinburgh date from 1505. We have a seminar each week where we discuss topics in a small group with our lectors. And 11.3 match each of these activities to one of the components of the undergraduate course, the screen B and C opposite. 1. Julie spent 6 weeks working in a small hospital in the Himalayas, clinical attachment. A group of students discussed together two of the possible reasons for abdominal pain after meals is an obese 44 years old male. Problem-based learning. A small group of students trace the pulmonary artery in a cadaver dissections. Otto spends a month working in the pediatric ward of the local hospital, clinical attachment, and learns how to take blood from an elderly patient's clinical skills. And 6. Juma chooses to study travel medicine in his 4th year. Students select model 13. 13.1 Complete the phrases with words from the box. Two phrases can be completed in two different ways. assess, deliver, demonstrate, prove, supervise, and take. Demonstrate a competence or how to do something. Supervise a trainee by ensuring the successfully completes her training. Deliver a course of a training program. Take a course or a training program as a student. Assess progress or competence. 13.2 match the two parts of the sentence. Um, Fee1 is a doctor. Is a doctor in the first year of the foundation program. 2. A demonstrator is an anatomy teacher and will teach us dissections. 3. A clinical training is a consultant and will provide training during periods of direct clinical care. 4. A supervisor is a consultant responsible for the training program of a trainee. 5. A medical school is part of a university responsible for medical education. 6. A placement is a period spent as a training in a hospital or in general practice. 7. A college is a body of specialists responsible for delivering and assist training in their specialty. And 8. A fellow is a specialist who has rated for highest level in their specialty. 13.3. Write in full the qualifications of the doctors and surgeons. Number 1. Bachelor of Medicine, Bachelor of Surgery, Fellow of the Royal College of Surgeons, England, Fellow of the Royal College of Surgeons in Ireland. Number 2. Bachelor of Medical Science, Doctor of Medicine, Member of the Royal College of Physicians. 3. Bachelor of Medicine, Bachelor of Surgery, Fellow of the Royal College of Surgeons. And 4. Bachelor of Medicine, Doctor of Medicine, Fellow of the Royal College of Physicians. 13.1. What kind of registration might as doctor of obtain? Number 1. A newly qualified Spanish doctor, provisional registration. A newly qualified Nigerian doctors, Lemurian registration. A doctor who has successfully completed the first foundation year, full registration. And CHO has successfully completed the foundation program and gaining a certificate of completions of training after several specialist registered post specialist registrations. 13.2. Write the abbreviations in words. Number 1. Any doctor who wants to work in the UK must register with the GMC General Medical Council. Some overseas doctors must pass the PLAD before they can register. Professional and Linguist Assessment Board. Part 2 of the test consists of an objective structured clinical examination. In any emergency, remember the ABC protocol, airway, breathing, and circulation. And 5. Before you can obtain a specialist registration, you must have a certificate of completion of training. And 13.3. complete the text. My name's Musa and I come from Yemen. I came to UK about 2 years A after graduation. Because Yemen is outside the EEA, I could only obtain limited registration with the GMC. At first, it was very difficult for me to obtain a pay test to show that I could work safely in the UK. If I had to give some advice to other candidates, it would be that at counseling stations, just choose sample memories a set of phrases. It's better to really think about what you're saying to the actor and get the intonations right. After completing my year's clinical training, I was up to obtain full registration, but I found it difficult to get a CHO post in my chosen specialty. Pediatrics as a hospital now have to demonstrate there is a sustainable candidate from the EEA. Once I've completed my second foundation years, I shall obtain a CCT, which will allow me to proceed to specialties registration with the PMC, an important step on the road to becoming a pediatric consultant.